Reporting from Port Moresby. Well, time for our regular look at our health, and we're joined by infectious diseases expert and Dr. Linny Fong. Good to see you, Linny. Of course, Labor romped it in over the weekend.
Yes.
Healthcare was such a focus at this election, much more than we've seen at previous campaigns, which is a good thing because a lot of Australians struggling to get into the doctor. Our health needs attention right now. But can you tell us, what are some of the social factors that are determining how our health looks at the moment?
Yeah, I think this is a really important point. I really enjoyed listening to the Prime Minister's speech. His victory speech talked about building a fair, resilient and strong Australia where people are not disadvantaged by the birth lottery. And I think in terms of that particular statement around birth lottery, like that spoke to those social factors. So when we think about social factors, we think about, you know, where you were born, where you live, where you work, where you play. And then we think about factors like education, housing, access to healthcare, for example, social inclusion. So really important things that can be shaped by government, whether it's at federal, local or state level.
So if you're in a poorer community, and that's why we see ill health be such a concern in remote areas, in urban and remote Indigenous communities as well.
Absolutely. Yeah, that's right. And I think that's why, in terms of looking at some of these social factors, some of the barriers are things like access to healthcare in terms of whether you live in rural areas or metropolitan Melbourne or metropolitan areas in general. What we know from the Royal Flying Doctor Service is that people in remote areas, up to over 22,000 people live at least 60 minutes from a GP service, which is, a huge contrast compared to when you're driving around some of the cities, and that there is a difference in life expectancy for up to 14 years. So there's a huge difference there. And then when we think about other barriers, like cost of medicines has been a really big one. Certainly what we see in the hospital systems is people skipping their regular medications because maybe they don't feel so unwell, but that, in terms of management of chronic disease is obviously a problem.
Must admit, didn't expect an election campaign where you spent so much time looking at a Medicare card with the number obscured.
I know, that's right.
As a prop.
Yes,
but there we go. While we've got you, are there any diseases at the moment, obviously we're heading into winter, that are really on your radar as a doctor?
Yeah, absolutely. I think one of the other kind of social factors that I was going to mention is health literacy. And so when we talk about health literacy, misinformation, we've talked about it before, is a really big factor. And so we think about vaccine and vaccine hesitancy. So at the moment, we know flu cases are over 70,000 now in Australia, and that's really early. We haven't hit winter yet. Yeah, we're not even at winter. And then the other thing is obviously there's been a lot around measles, particularly in the US, but also internationally. And so I guess we would encourage people to go and check their vaccination status. So get your flu vaccine. If you haven't, if you're born between 1966 to 1994, it's worth checking your vaccine records to make sure you've had 2 doses of measles-containing vaccine.
Oh, really? Okay.
Yes, because in that particular time period, most people only had 1 dose, and we're not guaranteed to have protection. And then the last thing is, if you are travelling with young kids, particularly those under 12 months, there is actually an early measles vaccine for over 6 months. So just, being as protected as possible as we head into winter.
Yeah, and if you've had your kids vaccinated at the usual times, that they should be okay.
Exactly.
Right?
So measles vaccine is given at 12 and 18 months in Australia. So most kids over those ages would be protected if they've had the vaccines.
Always great to talk to you, and we hope that health becomes a greater focus as so many people just feel a bit locked out of the health system.
Yeah, absolutely.
Yeah.
It's such an important factor.
Yeah.
Thanks, Linny.
Thanks, Linny.
Thank you.